Professor Gutenbrunner from Hannover delivered one of the keynote addresses on rehabilitation. Professor, what is the current perspective on this important area of medicine?
Rehabilitation has growing significance and importance in health systems in the future. So we know, on the one hand, for persons living or experiencing disability, it is very important that they get some support to readapt to life, to participate in all life areas, which is private life, but also professional life. Rehabilitation is a multi-professional approach, thinking about and addressing different functions, which on the one hand is the body functions, but even more important, the activities to support participation. And we know that this is important for many different types of diseases. It's well known for neuro diseases like stroke, like dementia, like Parkinson's disease, but it's also very important for internal medicine conditions, for instance, heart failure, for instance, vessel disease, respiratory disease, and many others. Of course, we know from clinical trials that rehabilitation is effective to improve or to increase functioning levels of the patients. There are quite recent studies about rehabilitation in acute care, in the intensive care units, and we know that, for instance, artificial respiration durations are reduced and the outcomes after the discharge of hospitals are better. But we also know for the post-acute phase that intensive rehabilitation is more efficient, for instance, in return to work or return to other activities, and we also know it for the long-term care in the community. And the challenge is in many countries of the world to implement rehabilitation service into the health systems. And there we come to the health policies, which is very much supported by the World Health Organization. And the World Health Organization published an initiative called Rehab 2030, a call for action. And all member states are urged to review their health policies if rehabilitation is in there. And that's what we try, if the ministries of health are open, to support these kind of initiatives.
And how is the WHO keeping up the pressure to get their recommendations adopted?
Yeah, there are documents and there are even motions in the World Health Assembly to do that. There's an action plan, a global disability action plan, also including rehabilitation until the year of 2021. This has been adopted by all member states of WHO. What WHO is doing now, it's a very good initiative. They designed a methodology to assess how much rehabilitation is provided in a country, and then to derive recommendations what should be changed in the next few years. And I think this is a very good tool because it's based on assessment of what's already there, and then trying to make recommendations for the implementation, which will be a long-term process.
If we were having this discussion in 10 years' time, what would be the situation in relation to rehabilitation?
Well, you see, to have the prognosis for the future always is very different. But what I feel from what is changing in the last few years, I think the awareness on the importance of rehabilitation for persons with disability is growing. There's much more awareness, and we know that they are part of our society we should support, and there are two approaches. It is a medical approach, but it's also an approach of society, it's a social one. So I think it will grow. The second one I think will grow dramatically is the knowledge of medical doctors, but all the other rehabilitation professions like physiotherapists, occupational therapists, speech and language therapists and others. So the knowledge is growing and the awareness of society will grow. So I'm sure in 10 years there will be progress, there must be progress, but I think in 10 years we also will talk about the next steps.
Professor, thank you so much.